Well, I think all of this information and talk about how the disease works and the inflammatory process also sheds more light on lupus because it's a similar, or at least there are some similarities in that we have an inflammatory process happening. So, to me, in my mind, it also emphasizes how important it is to keep research rolling and that there's such a need for a cure just because lupus already is life threatening. And so, again, we thank you for your work, Dr. Newald, and for all our supporters out there.
Yeah, it's a time that's scary for all of us, and especially scary, as you mentioned, if you already have a serious condition like lupus, and then to think about this health risk that's out there now. Um, as I'd mentioned earlier, I think the good news is so far we haven't been able to detect any special predilection of the virus for people with lupus. So I think, we'd all like this thing to go away as fast as possible, but at least I don't think there's a lot of evidence that lupus patients are necessarily more susceptible to severe infection, at least. So that's good news. But yeah, I think that it does. The point that you raised, there's just a lot that we don't know yet in medicine and in the immune system, and I think the exciting part is that the research can really help in a lot of different ways. As we mentioned at the start, having too much interferon is one of the things that we think leads to lupus, and so we've been working on this quite a lot, and we're optimistic that a drug might be approved that targets this pathway in lupus. It is also one of our most important antiviral defense mechanisms, and so in this way, I'm just a big fan of biomedical in general. I think that we learn things in some areas that can be applied in other areas, and I think that the things we've learned about interferon and lupus may well be helpful as we think about COVID as well, because we've learned more about how interferon works in the human body, and I think that it is a time where we have to do the initial first response, and obviously we have to do everything we do medically, but I think it's also a time where it's important for us all to kind of rededicate to biomedical research. It reminds us that there are really threats out there, lupus and COVID and many, many others that actually are dangerous and still need a lot of work.